one likes to think about getting older and not being able to take care of ourselves safely in the homes we've lived in for years. Sometimes we need a little help.
Some of the stories that really touch me personally are individuals we've found who have been living sometimes for years in their own bed in the community without support. And we've been able to meet them where they're at, allow them to get their medications, provide daily care for them, and really minister to them with the sisters' love in terms of their life, their existence, and comprehensive care and engagement.
That's Nathan Pritzker, Executive Director of OSF PACE. And I'm Shelli Dankoff, your host for OSF HealthCare Accelerated. We appreciate you tuning in and remind you to be sure to subscribe, rate, and review wherever you get your podcast. It's been almost 2 years since we introduced you to OSF PACE, a program that helps people age in place. An update to some of the stats we shared with you when we first discussed this program in 2024. An estimated 77 to 88% of adults over the age of 50 have a strong preference to remain in their homes for as long as possible. That's up from 77% in 2024. For adults 65 and older, that number is 90%, holding pretty steady to where it was 2 years ago. But as we all know, it's easier said than done. In 2024, OSF HealthCare launched OSF PACE for the greater Peoria area. That stands for a Program of All-Inclusive Care for the Elderly. That's what PACE stands for. We welcome back Nathan Pritzker, the Executive Director of OSF PACE, and Dr. Matt Gorman, Director of Medical Services, Care Management for the program. All right, let's start with the basic. How are things going? Where are we at 2 years in from your perspective? I mean, I know there was stops and starts at the beginning, but here we are 2 years later. How are you feeling?
So there's been a lot of growth over the last 2 years and a lot of milestones that we've met over that time period. It's really remarkable what we encounter when we start looking for individuals in our community who need help. Some of the stories that really touch me personally are individuals we've found who have been living sometimes for years in their own bed in the community without support. And we've been able to meet them where they're at, allow them to get their medications, provide daily care for them, and really minister to them with the sisters' love in terms of their life, their existence, and comprehensive care and engagement.
So when you say in their bed, are you telling me that for years they not only never left their home, but for some of them, they barely got out of bed or did anything?
That is true. We've actually have more than one individual who's had that experience. And each one's journey after we find them is different. For some individuals, we're able to get them out and get them into the community. For some individuals, it may not be a situation that we can save, but we can make more comfortable and help restore and give peace in their lives as they continue on in that journey.
So, Dr. Gorman, I will loop you in. From a medical perspective, that's not good for anyone to not have interactions to, even medically. How tough is that for some of the situations you're seeing medically?
Well, there's a whole host of medical issues, and it's really just a medical miracle that this person is able to live this long. And the isolation, and she had a good network, but definitely it's not how healthcare should be delivered. But it's how she chooses to live. And I think we were able to come beside her. And I think that's really the uniqueness of this program is we have other abilities that, in a traditional medical office, such as the medical group, there's just constraints of being able to do that. Telehealth has added the ability for that to occur, but really to have ongoing care and to maintain that patient-physician relationship, it's a challenge. And home and house calls are a rarity in this day and age, but in PACE, it's definitely something we can do. And to add to your first question, though, I think we're pioneers in healthcare for OSF HealthCare, and this is just a new pioneer. And as the days of the old pioneers, it isn't easy. We've learned a lot. We've taught legislatures a lot. We've taught the state a lot. And our organization continues to grow and strengthen because some of the things that we're learning today from this program, we're able to spin out to other adjuvants of our healthcare ministry. So I do think we're really making progress. It's just been slower than we all anticipated.
Right. And I remember a couple of years ago when we talked, it was, okay, how do you get the word out? Who is your target audience? How do you wrap your arms around and bring those people in? So let's remind everyone, who is the target audience for this and how are we finding these people?
The target audience is someone 55 plus in our service area and with a valid payer source. The state has a criteria that they must be nursing home eligible. A lot of the learning we've done has been educating the community on what nursing home eligible looks like. And it's much different than what we think of in our traditional healthcare setting. It's really someone who is struggling with multiple social determinants of life, whether it's access to nutrition, language and education barriers, mobility barriers, physical and psychosocial limitations. And each individual is so different in their manifestations. It's very, very unique to educate the community on what that looks like. Some of the most successful avenues we've had for outreach has actually been targeting low-income housing. We've developed relationships with many of the senior high-rises in our community and have continued to educate and build relationships with those organizations on what PACE looks like and how PACE is a symbiotic relationship for them. We've also continued to build relationships across our own healthcare ministry and educate on what PACE looks like and what a success can be. One of our physicians shared with me recently that PACE is an outlet for the people that keep her up at night. And this is an opportunity for her to try and get them better care and better access to their needs. It doesn't always work out because there's individual choice involved, and that's been another learning curve for us. We may believe a certain course of action, PACE, or a certain care plan intervention is right for someone, but it may not be right for that person at that time. So it's been a little bit of an education and learning journey there.
Yeah, because one of the things, pride enters into this, and as you get older, and again, as I approach more to that age, I think some people, I've always done it this way. I've always cared for myself. I can do this. I don't need you. I don't need some stranger coming into my house telling me how to do things. I'll make it work. Is that some of what you're dealing with as well? Plus, it's not the traditional, I'm going to my primary care physician, which this age group typically did back in the day. They at least had that connect. But is there some of that, just the pride and the I can do it myself mentality that you're having to overcome?
There's a lot of factors that go in that, and to unpack that is significant. But pride is definitely also denial in terms of how ill they are. The other thing is their caregivers or lack thereof in terms of, their friend who kind of helped bring them meals or was able to continue to have them live safely at home. When those deteriorate or go away, either from death or moving or their own illness, it really puts other people vulnerable. And then there's also in terms of where families have, recognized the need that they're trying to live their own life too. And so the sandwich generation of caring for their own kids plus their parents does put a lot of pressure. So I think those are kind of multitude of factors that go into this. And so I think that's where PACE kind of fits that gap for those where the clinicians realize that there's just not enough resources to tap into the community, or patients don't want to participate in those resources because of the pride, or, they don't want to have Meals on Wheels, or they don't want to have whatever the community offers. And transportation is probably a bigger barrier that, as we get older, the safety of driving an automobile, I can just speak from my own mom, that, she knows that as soon as she loses that ability, that her world becomes a lot a lot smaller. So I think those are the other factors that factor in terms of, as long as you have that mobility, either ability to move yourself, but also the mobility of transportation. And to do that, that really factors in the patients that we're serving.
So is this a combination of programs that come into the home and check up on those who are enrolled in PACE, as well as going to, say, like a day services setting where you can go and hang out? Talk about how that works as well, because there's opportunities for socialization to get them out of the house that I would think are huge for not only the physical but mental state. Let's talk about that.
Yeah, so I think it's a combination of all of those factors that you listed. Each individual is different, and PACE is an incredible program for recognizing the nuances of a person. We deal with a small number of individuals, and our team is very cohesive in terms of communication, in terms of being in the same building. And so we, as a group of individuals, a group of providers, caregivers, and compassionate individuals, get to know that person, get to know their needs, their wants, and their goals in a very intimate way, so that we can meet them wherever they're at, and also transition through life with them as they go through the inevitable arc of eventual decline and wherever that takes them. And so we get to know them and partner and follow that journey, regardless of whether it occurs in the home, whether it occurs in our center, the community, or some alternate setting as they continue to age and go through life.
So for now, this is still just in the greater Peoria area. Is that correct?
Yeah, the Tri-County area, for simplicity, I think if you're in the Tri-County area, there's some zip codes that may not fall into that. And so as we look to potential expansion, that is a possibility, but really the Tri-County area is really our zip code designations.
Yeah, and that, because, OSF HealthCare reaches across the state of Illinois. Is there a desire? We all know there's every community across the state, and some of the larger ones, they have this need out there. Peoria is not unique. Are there opportunities that perhaps we're looking for?
There are a lot of potential opportunities for expansion. It's a very complex effort to expand that requires both government approval and organizational investment to make happen. It cannot happen overnight. It's a multi-year process with a lot of planning. So the conversation is definitely happening. The state is also becoming much more aware of what it takes to scale and grow this program. So as the first PACE program to open in the state of Illinois, OSF has taken a leading role in working with the other programs that have opened since to start to organize and advocate for the best ways to facilitate growth and facilitate expansion of PACE, both in our market, in the markets OSF serves, but also across the state, working with legislators and the different bureaucracies to make that possible.
Yeah, I love that word bureaucracy, because I am sure, and you alluded to it a little bit ago, just some of the challenges. And we've had some discussions around, telehealth and all of those other things that for some reason everybody goes, this is a great program. Then why is it so darn difficult to get it spread far and wide and to implement it? I get you need to have guardrails and for safety's sake, but do you get a little frustrated sometimes that we are overly cautious when so much good could come out of it?
It's a challenge. And I think when you see it and you see the benefits and you see the excitement of not only the participants, but also the caregivers, it takes us back to the roots of really helping others. And you really see the satisfaction of the ability for, and part of it is aligning with goals of care and really doing what the patient wants, and also educating them in terms of things that, may not be realistic, but we're still going to try. But it's not a hard no. It's, well, yes, if. And so how can we do that? and make sure that they're safe or understand that they recognize that they're unsafe, but we're willing to kind of come beside them because they want to live at home. But how can they be safer at home and where they don't have a caregiver, they don't have someone helping them, and using technology that wraps around them to remind them to take their medications, to, turn off the stove, and all other things that we kind of take for granted in our everyday life that we see, and, just getting from waking up to going to bed and everything in between. And we're kind of responsible for our participants during that time frame. So, it really is a joy of healthcare. But spreading that, there's the financial, just because you need resources to really get this up and running. And then it takes time to recruit patients and there's a lot of competing. Med-Cs are definitely working in this space and understanding, and there's other corporations that are looking at this in terms of these patient population to kind of serve this need, but not in more of a traditional setting, not in kind of where PACE kind of has other resources that is a value add to many of our participants.
Yeah, I would think people would start to see the value because there aren't enough nursing homes. There aren't enough family members to care. That we've all those things we've talked about. You need to come up with something else. I would have to believe from a physician perspective for you, when you see that a participant is at least excited to try something or they're wanting to push the envelope, that's probably better than just sitting back on, okay, I've given up. Does that kind of help a little bit? All right, we may need to figure this out and pump the brakes a little bit, but I'm glad to hear you're now engaged and you want to try things. From a physician's perspective, how does that make you feel?
It really energizes you and gets you back to kind of why you got into healthcare to begin with. And it also gives you energy when you're fighting the bureaucracy, when you're looking at why can't this be simpler? And you kind of can get that patient and face back to kind of say, this is why I'm doing it. And, this is why we are taking the lumps and bumps in terms of this is why we're working down with Springfield and why we're trying to change their mindset and working against the state programs. We're competing against some state programs that adds to this. And so when we know this is a far superior program and has good outcomes, I think that's the other thing you can see. And the thing is, when you talk to other colleagues in other states, they have the same resistant pattern. And so this is not unique to Illinois, although Illinois definitely has some uniqueness that others do not. But there definitely is a joy to healthcare, and you can see it in our building and you can feel it. And I think that's what participants feel, is they feel welcome. It really is living the mission. Really kind of touching, connecting with our patients. And not that you can't do that in other avenues of ministry, but you can see it every day. And I think that's really gives you joy and wants you to get back to work.
Does that come from the other clinical members? Let's make the connection between other clinicians, our primary care physicians, who oftentimes are the first line of, hey, Cousin John over here, we're seeing such and such. Do they sometimes see things first and bring them to your attention?
I think that's the beauty of the team. Our team works together, and our participants establish trust with the different elements of the team, whether it's someone who looks like them or speaks the same language, or just the caregiver who most readily encounters them. And it also spreads far beyond our existing caregivers into the people we are recruiting to grow our program. Most recently, we hired an individual who was moving back from out of town and chose to work at our program in PACE because her grandma was treated by PACE, and she became so enamored with our program and the uniqueness of the work that we do and our engagement with individuals that she wanted to work in our center.
Are there other stories that jump to your mind of that patient who, we mentioned the one who hadn't gotten out of bed and now you've seen the difference. Are there other stories like that, or the ones that you kind of reference? You get up in the morning and go, okay, that's the face I see. That people would be surprised to hear. These are some of the results. People always love to hear the positive outcomes. Other stories that come to mind?
I think one of the stories that touches me, and I think I'll carry with me for many years to come, was an individual we enrolled about a year ago. She was a very proud and is a very proud and independent person, but has gone through a series of family traumas that have impacted her deeply psychologically and from a cultural perspective. She's in her 90s now and continues to be very proud and independent, continues to live alone, but also continues to struggle with the trauma and regret of things that have happened in her life, in her past, and with her family. And we can't resolve all of those traumas for her, but we're able to support and give her peace and be a partner with her in that journey at the later stages of life in a way that no one else has been able to, and really support her when she would have nothing else.
Gives her a reason to get out of bed in the morning. It really does.
There's a lot to draw on. I think one of the ones that really is heartwarming to me is we had a participant that her son was in a show, and we coordinated to be able to get her transportation to see her son perform. And it really was heartwarming, and you kind of can see the benefit of that and just how it energizes the rest of the team. And then I think we have from the whole circle of life in terms of where you see them kind of aging in terms of, and part of aging is ultimate death. And I think you can see death with dignity. And we've had a couple passings, and it's been rough on our mission partners because they're so invested. But I think when you get to see the peace that comes with that in terms of that they died with dignity, they didn't die alone. And I think that's kind of some of the other things that are also. The other one that just is heartwarming is one of our participants just loved to ride the bus. And we're measured by how long they're on the bus. And so we had to kind of factor that in. But I mean, it was just the joy of her recounting because she hadn't been back into society because she was kind of isolated. And I think that was the other big thing that we learned from COVID is the isolation on the elderly, but even individuals of that you got used to and you lose community. And so I think that's when we're just getting back out and seeing, how much Peoria had changed in 5 years. And I think those are kind of, you think of just things you take for granted. And it's like going back home if you don't live locally, when you go and you're like, wow. And you tell your kids, that was a cornfield. And, they look at like, wow, Dad, that's a great story. But you can see the change, but you see the excitement in her eyes when she got off the bus and just was kind of enamored with just how much Peoria had changed over the 5 years that she had kind of not been out.
So she went and rode a bus. Just the joy. Again, sometimes it is the simple things that we really. And I think I would have to imagine, because people think of aging in place and older people. But when you say it's 55 and older, 55 is somebody who's gone north of that. That's not that old. But to think, do you also try to educate people that the sooner you get in services and get the help, that helps extend your life longer? Get yourself help earlier or get your loved ones this additional resource to help you. Then it will be better for everybody. Is that part of the education process?
That has been a big part of our education process over the last couple of years. As we began, many of the referrals we would get were truly a step away from crisis or already in crisis because a situation had progressed too long. But as we're getting more versed in what PACE is and what PACE looks like, we're beginning to catch people earlier in their decline or earlier in their life journey and put preventative measures in place so that they can continue longer in the situation that they would like to live in and in the community settings and social circles that they want to be a part of.
Okay, as we get ready to wrap this up, I'm going to put the question out to both of you. What lies ahead? What's next for PACE? And then what excites you most about what lies ahead? I'll start with Nathan.
There's a whole lot that lies ahead in terms of continuing to grow the program, education, participant recruitment, and growth are really what will drive us to the next level. What really excites me and gives me a reason to get out of bed every morning and go to work is the smiles and the stories from our individuals. seeing a life we've changed, seeing someone who's happy and has a community has been one of the things that is most meaningful to me in the work that I do.
Dr. Gorman?
I think growth is probably the biggest thing in terms of whether it's just growth in our current center, but even future growth throughout the state is probably the other thing that keeps me up at night, but also gives me energy. I think the other big thing is seeing how we can impact and getting earlier referrals. We were still here for those catastrophic, because I think we have been successful in changing some of the trajectory. Sometimes it's a little bit, we even with the resources we have, we unfortunately can't keep them safe at home. And then we can definitely get them into a nursing home, which is just a safety. But I think the big thing that energizes me is just that this is good care. This is what the sisters started out with, and this is just propagation. And unfortunately, the population is aging, and so I think, and the nuclear family is changing as well. And so we have more patients or participants that don't have that core group to kind of help them transition as they get older. And I think that's where sometimes our modern healthcare really doesn't factor into that. And so I think that's where PACE can be well situated, but also can wrap around people that do have caregivers, but can kind of help ease their burden, particularly with dementia. And caring for a loved one with dementia is challenging. And I think that's something that we can really help in terms of continue to foster that relationship and not become, you can still be a daughter, you can still be a son, or you can be a grandson. And, enjoy that moment and not always be the caregiver. You can still be the caregiver because there's some joy in that, but you can kind of offset some of that to PACE. And so I think there's some opportunities there. So I think in conclusion, if you think that your loved one or you as a patient think there's opportunities, don't hesitate to reach out. We'll go through all the semantics in terms of whether it's a good fit for you. In terms of whether you meet criteria, because unfortunately this is a government program, and so there are bureaucracies that we have to follow. But I think don't hesitate to reach out is my opening or closing point for you, is that we're here, we're available, and we would like to serve you.
Is there a phone number or a website that's easiest to do that?
There's the OSF PACE website has a contact us page, and that is the best way to get a hold of us. And we also have now an Epic referral for any provider who would like to refer a patient over.
That's awesome. That helps significantly. So again, go to osfhealthcare.org, search for PACE. It'll get you right there. Dr. Matt Gorman, Nathan Pritzker, thank you for the update. It's a more joyful update than when we started a couple of years ago, because there were a lot of challenges that laid ahead, and you knew that, but you've gotten there, or you're getting there. Let's put it that way. So thank you for the updates. It's good to hear.
Thank you.
Thank you.
And thank you for joining us as well. And remember, you can check out all of our episodes at osfhealthcare.org/accelerated.